The thyroid is a butterfly-shaped gland in the middle of the neck, located below the larynx or voice box. The thyroid produces two hormones, triiodothyronine or T3 and thyroxine or T4, which regulate how the body uses and stores energy. Thyroid function is controlled by pituitary gland, which produces thyroid-stimulating hormone, also called TSH, which stimulates the thyroid to produce T3 and T4. What is hypothyroidism? Hypothyroidism is the medical term for when a person does not make enough thyroid hormone. People sometimes confuse this condition with hyperthyroidism, which is when a person makes too much thyroid hormone. 95% of hypothyroidism is due to a problem in the thyroid gland itself, called primary hypothyroidism. However, certain medications and diseases can also decrease thyroid function. Hypothyroidism can also develop after medical treatments for hyperthyroidism, such as thyroidectomy or radioactive iodine treatment. In some cases, hypothyroidism is a result of a decreased production of thyroid-stimulating hormone by the pituitary gland, called secondary hypothyroidism. What are the symptoms of hypothyroidism? Some people with hypothyroidism have no symptoms, but most people feel tired. That can make the condition hard to diagnose because a lot of conditions can make you tired. Other symptoms of hypothyroidism include constipation, slight weight gain, mild swelling around the eyes, getting cold easily, decreased sweating. The skin may become dry and thick, the hair may become coarse or thin, eyebrows may disappear, and nails may become brittle. Hypothyroidism weakens the respiratory muscles and decreases lung function. Hypothyroidism can also lead to swelling of the tongue, hoarse voice, and sleep apnea. Hypothyroidism slows the heart rate and weakens the heart's contractions, decreasing its overall function. Related symptoms may include fatigue and shortness of breath with exercise. In addition, hypothyroidism can cause mild high blood pressure and raise blood levels of cholesterol. In women, hypothyroidism can disrupt monthly periods. It can also make it hard to get pregnant. In women who do get pregnant, hypothyroidism can cause problems. Treatment of hypothyroidism can decrease these risks. Some people over age 60 have few, if any, symptoms of an underactive thyroid gland. These include constipation, heart failure, muscle or joint pains, psychiatric problems including depression, psychosis with delusional behavior, or hallucinations. Older people can have unexplained high cholesterol, and older people with a very underactive thyroid gland can sometimes be misdiagnosed as dementia. In severe hypothyroidism, trauma, infection, exposure to the cold, and certain medications can rarely trigger a life-threatening condition called myxedema coma, which causes a loss of consciousness and hypothermia or low body temperature. Thank you for listening. Be healthier.